Hi, this is Vaishnavi of second year medical student. So now I am going to perform upper extremities and lower extremities of your body. Is that okay?
Yes.
So what is your name and age?
Sympathetic 11.
Okay, fine. So let's start the procedure.
Yes.
For general assessment, assess the body position in voluntary movements and characterize the muscles, especially the muscle strength, and observe the patient body position during the movement. Also, at the rest watch for involuntary movements such as tremors, tics, or any kind of scaltations. Inspect the size and contour the muscles. Look flat or concave suggestions any kind of atrophy that is unilateral or bilateral. Pay special attention to hands, shoulder, thighs. Even evaluate patient's muscle tone. Passive stretch. Ask patient to relax. Take one hand and while supporting elbow, flex extension of patient of fingers, elbow, put shoulder, moderate range on each side. Note muscle resistance. While testing, muscle of the patient resist and examiner overcome the patient's resistance. Having a patient in supine position. Support the patient's thigh with one hand and grab the foot with the other hand. Flex and extend the leg on the each sides. And now note the patient's leg and assess the both legs. See for the movements. And now note the hand of the dominant side is stronger than the other hand. Flexion of the biceps muscle behind his hand at the elbow and now pull against your hand. And for triceps, put against his own hand. Now look for the resistance in the both hands. For flexion, ask the patient to make wrist and resist try to push downwards. For extension, ask the extended forearm fingers straight and press palms downward. For this, ask the patient to squeeze your fingers as hard as he can. In meanwhile, you remove the fingers. By this, we have troubling the fingers. To do this, turn palm downward and spread his fingers. Now check for the duction forcefully together. The other hand as well. And now turn towards and ask him to touch thumb with the little finger for opposition. Now resist the movement. It is impaired in the carpal tunnel syndrome. Ask the patient in the supine position, hand on the thighs, and ask patient to raise his leg against the hand slowly. And now for the hip extension, place a posterior thigh and ask pull him downwards. For hip abduction, gluteal medium and gluteal minimus. Place firmly on the outside of the patient and spread the both legs against your hands. And for adduction, hand in between knees and bring both near to absorb the strength. For dorsiflexion of ankle, pull up against your hands and it is not resistance. For plantar flexion, ask the patient to push downward against the hand. Here completes the procedure.